Hi, this is Tony Preston. I'd like to talk about integrative body work. You have to kind of start with the vocabulary there. Let's talk about the idea of holistic and integrated and integrative. Holistic is the idea that the parts interact. It kind of says, listen, the body has some structure, it has a mental state of emotions and thought, it's got some biochemistry, and those pieces play with each other. Any good psychotherapist would tell you that they can change your posture, their postures of sadness and happiness, and that it affects your immune system as well, so it's affecting your biochemistry. Any nutritionist or pharmacologist would tell you that they can change your mood by changing your biochemistry, and that they can change your structure through nutrition as well. A good structural therapist as well knows that their work can change the immune system and the biochemistry, and that it can also change your attitude, make you much more regulated and regulate you there. So we have this idea of holistic. Um, that holistic model then you can take into the idea of integrated therapies. Integrated therapies mean that the therapies work well together. This icing helps this area reduce inflammation, so then it's less aggravated when I work on it. So the icing and the massage work well together, or this massage work goes through and treats trigger points, and this stretching afterwards helps to integrate that muscle into the muscles around it so that they all lengthen well. So integrated is the idea of techniques that work together. Integrative is different. Integrative says that I understand there are pieces that govern a pattern, and that those governing pieces have accessories in the pattern. If you're looking at the blog post that goes with this, it's very interesting. I talk about a pattern that happens in the back of the ankle where you're unstable when you walk, and that piece is a trigger point that comes off the peroneus longus muscle. That peroneus longus muscle and that particular trigger point is governed by the joint between the fibula and the tibia. So there's a joint technique you can do that releases the trigger point instead of releasing the trigger point directly in the muscle. That joint problem in the tibia and fibula is then governed by a shearing that happens in the pelvis, where the pelvis has sheared anteriorly on that side on the sacrum, and you can solve the problem in the hip, and it will oftentimes directly solve the problem in the tibia and fibula and in the peroneus longus, and therefore the instability in the ankle. So the work at the hip is more integrative, and the work down in the muscle is more symptomatic. This goes a little bit further. In craniostructural work, there's the idea that there's a lateral strain problem in the cranium, and by making changes to the lateral strain pattern, you can then cause the hip to change, which causes the joint to change, which causes the muscle to change, which causes the trigger point and the instability in the ankle to go away. So the cranial work is very integrative. By doing that work, I often solve all of the other problems, but at least one of the things that it does is to set it up so that if I work in those other areas, at least it set them up so that the work is longer lasting and the cranium's not in a position to perpetuate or reinstate a pattern. This is the difference between integrative work. So oftentimes I'll run into an issue with somebody who's got a shoulder problem or a hip problem or a low back problem, and if I'll work in their cranium first, oftentimes the problem just goes away. So I have many people get off the table and go, I've got this low back problem. I don't, it's gone. I don't know how you got rid of it. You didn't really work on my low back. I guess it just went away. I find this amazing because I'll say, you've got this low back problem. I'm going to do some work on your head. It'll fix your low back. It'll make things work better. I will work on their cranium. They'll get up without the problem. And still they have trouble connecting the cranial work to the work that I did in their low back. So integrative work doesn't just solve the problem. It creates a catalyst that changes a lot of other pieces in the pattern. So integrative is the idea of creating this catalyst that causes the system to integrate, as opposed to integrated techniques or techniques that work well together, as opposed to holistic, which says that we understand that this is a whole, that the pieces affect the other pieces. There's a blog post on this. You should take a look at that blog post, and it'll explain this in better detail and has some other examples in there. I'm Tony Preston. Thanks for listening.